Hello, listener. My name is Nisha Pinar, and I am an artist radio young reporter. During the Registrar show, I will be interviewing Dr. Norbertta Washaya from Recross Children's Hospital. Norbertta is a pediatrician who specializes in children's lungs, also known as pulmonology. She's a mommy to a 2-year-old and is originally from Zimbabwe. She looks forward to improving child lung health from Africa and beyond. Dr. Norbertta is going to share with us why smoking is bad. Please note that due to the COVID-19 pandemic, the interview is over WhatsApp, so the quality might not be so great. Why is smoking bad for you?
Hi, Nuroo. Thank you so much for having me here today. First of all, it'll take hours just to discuss and explain why smoking is bad for you. But the short answer is it affects a lot of your body systems, especially the lungs. It causes you to catch infections easily, and as you're well aware of later on, you're at risk of lung cancer, meaning you can die young because of that. In the heart, you're at increased risk of heart attacks. In the brain, you can get strokes. The bones can get weaker, so easy fractures. So, in summary, if you're a smoker, you get sick easily.
How can secondhand smoke hurt children?
So, to answer your question properly, we first of all have to explain what secondhand smoke is. So, secondhand smoking is what happens to non smokers when they're around people who smoke. So, for example, let's say you're sitting in the lounge with your father and he's smoking. He is going to take a deep breath in as he smokes, and then he's going to inhale it, and then he's going to exhale it. And what he exhales, because you're in the same room, you're going to breathe that in. So that is secondhand smoking. The other problem with secondhand smoking is that the cigarette itself is going to be burning in your presence, and you're also going to breathe that in directly into your lungs. Your father, when he inhales, he's got a filter in that cigarette. But you, when you inhale directly from that burning cigarette, you don't have a filter. So secondhand smoking is a problematic because you're going to inhale that smoke that came from your father, as well as the smoke directly from the cigarette. And we know that children who are exposed to secondhand smoke are at risk of chest infections. And if they have asthma, they tend to have severe asthma attacks. And because you're actually smoking, you tend to end up having the risk factors that we spoke about earlier on. And sadly, we also know that children who are exposed to a lot of secondhand smoking also end up smoking when they're older.
Why do people choose to smoke if they know it's bad for them?
That's such a good question. One would actually think that because we know that smoking is bad, people wouldn't actually smoke. But the issue is that most of the times when people start smoking, they start smoking when they're young. And people will tell you that the first smoke is horrible. They'll tell you that the chest was burning and they coughed and coughed. And for some people, they never smoke after that. But for others, they keep going back. And the question is, why would you? There are a few things that you can consider. If you're a teenager, it could actually be peer pressure. People think you're not cool because you cannot handle the smoke, which is totally wrong because you don't need to smoke to be cool. And then the other reason is nicotine. Nicotine is found in cigarettes, and it is very, very addictive. And that's what keeps people coming back. When you've smoked enough, you get to a point where you feel like you cannot have a normal day. It's kind of like how people get addicted to drugs, which is why you're taught that actually stay away from it, because once you start, you might not be able to stop.
What is the difference between a cigarette and an e-cigarette or vape? Which is worse?
I am so glad you asked about e-cigarettes, because someone might actually say, you know what, I know smoking is bad for you, but there's e-cigarettes, and I'm told it's safer than smoking. The other problem is that they're made to look cool. But the question is, At what cost? So the problem with e-cigarettes is that they're actually not regulated, meaning anyone can put anything in there at different amounts. So you have no guarantee that you've got a certain amount of X, you have a certain amount of Y, you've got a certain amount of Z. So that is dangerous. The other issue is that they contain flavorants and flammable gases, and these can damage your lungs. And sometimes the damage happens suddenly and quickly, even at a young age. You might even end up needing to be admitted in ICU because of the damage that they cause to their lungs. The issue with vaping as well is sometimes you might actually end up smoking the tobacco itself. So at the end of the day, vaping is not a good substitute of smoking. It also has its disadvantages.
Can you explain if COVID-19 could have worse effect of people who smoke?
I knew we were not going to finish this interview without a COVID question. So, as we said, smoking in general increases your risk of lung infection. So one can also assume that it would be the same with COVID-19. That is, if you're a smoker, you're at more risk of contracting COVID-19. And smokers can have a more serious COVID-19 infection compared to non-smokers.
What did you think about the ban of cigarettes during the national lockdown?
You have asked a very hard question. I think the issue of dealing with COVID-19 is that we're dealing with something that we have never dealt with before. And we're using past knowledge to decide on our present steps as well as our future steps. So you're kind of looking for the best evidence as to what is the best way and what is the best approach. So as pediatricians, anything that would improve or protect child health, and in my case, particularly lung health, would be beneficial. So at the time of the lockdown and when everything was happening, the powers that be chose a path and made a decision that would hopefully protect a majority of people and especially children.
Red Cross Children's Hospital has banned smoking on the hospital grounds. What do you think about this?
I remember the day I drove into Red Cross Hospital and I saw those no smoking flyers. I was so excited. It was like so long overdue. Finally, it's happened. Finally, it's done, because it doesn't make sense to have a children's hospital where we manage lots of children with lung issues and lung infections, and yet we're doing the thing right outside the hospital that increases the risk of lung infections.
What would you say to parents to encourage them to stop smoking?
To the parents or the big brother or the big sister or the auntie or the grandmother or the grandpa, whoever you are, who wants to stop smoking but you feel that you can't, I want you to know that I know it's not easy, but think of your children and think of their health. Think of their desire to have a healthy parent, a healthy aunt, a healthy uncle, a healthy brother, a healthy granny. Keep that in your thoughts each time you want to smoke, and try use that to motivate you to stop.
Is there anything else you'd like to say?
First of all, I just would like to say thank you, Nuroo, for the invite and the interview. It's been fun. You had a few hard questions, but I hope I answered your questions clearly. So thank you so much. Thank you for what you're doing with Red Cross and the message that you're spreading. It's going to go far and wide. And my closing words would be, little lungs need big people to care enough to stop smoking.
You are listening to RX Radio.
For and by children.
RX Radio. RX Radio rocks.